So the next question comes from a woman with MS in her 60s. She says, I've had problems with my bladder for a long time, but, and I apologise, Jalish, I find it difficult to talk about it with my doctor. How can I deal with this? Are there other health professionals who could help, and how do I get in touch with them? Noreen, do you want to?
Yeah, I would say that I think most people are probably embarrassed to talk about their symptoms, but actually it's something that they shouldn't be embarrassed about. You know, most of us at some point in our lives or other might have a symptom that makes us unhappy. I would say most healthcare professionals are going to be able to talk about it. Certainly MS specialist nurses. Most areas are going to have teams of continence specialist nurses who are great, as you found, Amelia, who really know their stuff. They're going to be really approachable. They're not going to make you feel embarrassed. They're going to make you feel quite relaxed. So I would say either your specialist nurse or your GP. Sometimes it's, you know, you can say to them, actually, I'm having a bit of a problem. Who can I go and see?
Yeah, definitely. I'd back that up completely, because when I was referred to the bowel care unit, there's almost that feeling of there's this big ogre behind the door and you're not quite sure because you've got this big subject you need to talk about, and actually you get in there and they are the nicest people. They're human beings just like you. They work exactly the same way that you do, and they find it really easy to talk about because that's what they do. So actually, you know, and this is one of the things, is breaking down the barriers of being able to talk about this. You know, it is something we all do, so it shouldn't be the big taboo that it is.
I mean, I feel that out of all of the symptoms that come with MS, I think probably the bladder and the bowel are the most easily treated and managed, and there's an awful lot that you could do for yourself.
Yeah, we have there is the Bladder and Bowel Foundation, and obviously they've got a telephone and a web page, and they will either talk to you on the phone, or else they'll they'll actually give you the number of the local continence service that you can access, and most of it is an open referral as well, sort of thing, so you can contact
Bladder and Bowel Foundation helpline's great, isn't it?
So do you have any tips about how you might start the conversation off, like just how you first bring it up in a consultation with whoever it is? What could people say?
I would normally say to people, say something like, I'm having a bit of a problem when I go to the toilet. Then that opens it up. Or sometimes you're right about GPs. Sometimes I say to people, well, go and talk to your practice nurse, or go and make an appointment to speak to the female GP in the practice. That you might find that it's easier to start that topic off. But I think just, I'm having a bit of a problem, that will usually open up. They'll ask you then the questions on. I think it's just getting that first phrase out, isn't it?
Yeah. And I think probably, I mean, it doesn't matter what problem they're going with in their MS sort of thing. I think it's actually obviously the medical person as well, being a wee bit perceptive, if you like, sort of thing, about what problems they might have, and ask, and kind of opening up the question as well. I think we have a lot of responsibility as well.
And I think actually that's a good point, is the fact that they almost anticipate what you're going to say anyway. So, and like I say, I'm very lucky with my GP. She's really understanding, and being able to just kind of start the conversation, and they pick up on what it is you're actually trying to get across to them. That makes it a whole lot easier.
And I must say that if there's half an hour is a luxury nowadays, but and with the MS nurse, the MS doctor, there's quite a bit to cover. I mean, there's issues about gait, spasticity, pain, and so there's a long checklist of things to cover, and amongst that is bladder and bowel issues. And often, as things down below are often kept, they're at the very bottom of the waiting of the checklist, and so it's probably the last 5 minutes where actually the question is asked, and of course, and so it might be that it's addressed initially, but then it's followed up subsequently either in the next visit, or perhaps with a nurse, or with someone who the person is sort of more comfortable with to sort of to follow that up. So perhaps the next visit, the focus would indeed be more on bladder and bowel, where this is sort of brought up. And I think it could be sort of starting with the least embarrassing problem that you're more comfortable with dealing with or talking about, and then that could serve as a way to sort of then enter into the rest of the areas that need to be sort of discussed. Really.
So you get your confidence up a little bit, and then
Yes.
I mean, we certainly hear at the MS Trust when people ring into the information service, they very often are trying to think about how they can bring a topic up, how they can prepare for the appointment, so they can raise an issue that they feel vulnerable about bringing up.
I think people need to be reassured that most, all healthcare professionals that they're going to come across are going to have some knowledge about bladder and bowel, and if it's not their specialist subject, they'll know who to refer into. So it's not being afraid to talk about anything. You should be able to go in and say to your should be able to go in and say anything to your MS nurse. There's probably or your urology nurse.
A lot of our referrals actually come from physiotherapists and OTs.
Yes.
They do because they notice it a lot while they're trying to do their work with them. So a lot of our referrals come from that.
And if people are embarrassed to talk about it to somebody face to face, charities like Bladder and Bowel Foundation, it's a confidential helpline. You leave a message on an answering machine. That's transcribed. Whoever's ringing you back is going to be a specialist nurse, a specialist physiotherapist. They're going to know what they're talking about. They might be able to give people quite basic advice, but then signpost them to their local service. So, and all that information is totally confidential, so you don't have to worry. You might be able to sort the problem out there and then.
I think it's also important to remember that these symptoms are eminently treatable, and there are quite a few options that are available. And I think, so if it is a problem, I think it is important that it is brought up at a time and discussed, and so that these options are then made available and discussed.